Hi, good morning. My name is David Meinertz. I'm the founder and CEO of Zava. Zava is the largest digital healthcare provider in Europe. Zava allows patients to access doctors and medications in a manner that is instant, convenient, and at fractions of today's cost. Just this month, we're doing about 100,000 paid consultations, and we're on track to deliver more than 900,000 paid consultations this year. Since I started the business in 2011, we've provided more than 2 million paid consultations across 6 markets in Europe: Germany, France, the UK, Austria, Ireland, and Switzerland. So how did we win in these 6 markets? We won in these 6 markets for 2 reasons. Number one, we've built a really exceptional patient experience, which is scalable. And number two, we have a healthcare model which focuses on maximizing doctor efficiency. So how does Zava work? A typical patient would be a young woman who's on the contraceptive pill, and she would go online and complete a condition-specific medical questionnaire. We'll ask her the same questions as a typical GP in a surgery would ask her. However, we do this all online, so there's no need for a waiting room, there's no need for an appointment, there's no need for a video call or a chat. The woman can complete the questionnaire on the bus, at work, in front of the TV, whenever it suits her. One of our doctors will then, typically within the hour, review the answers, and based on these answers, we'll provide advice to the woman, and if necessary, issue a prescription. This prescription will be sent to a pharmacy, so this woman can pick up her pill within a few hours from a nearby pharmacy, or we send it to her by post for the next day. Patients love this experience because it's instant and super convenient. And regulators approve of this model because it's all based on structured inputs. And structured inputs, a written model, allows doctors to really focus on the answers the patients have provided, and it's very safe and can be reviewed, assessed, and also there's an audit trail between all interactions between patients and doctors. So today, we build our data inputs from questionnaires. If you suffer from a skin condition, you upload a photo. If it's a more complex condition, we send you a test kit, or we ask you to take some body measurements. These structured inputs allow us to pre-assess, pre-qualify the patient, the condition, and then route it to a doctor. And this allows doctors to batch consultations and then work very safely and efficiently with these patients. As a result, doctors on our platform are about 20 times as efficient as a traditional GP in the NHS. A hard-working GP in London will probably do around 50 consultations a day, face-to-face, in a surgery. A doctor on our platform can do around 1,000 consultations. Now, these efficiency gains we built not by replacing the GP with AI or putting the GP on a video call or a normal call with a patient. We win in this market by building software which allows the doctor to make very fast and very safe decisions to help the patient. And as you can see here, you'll see the number of increasing consultations over a 5-year period or 4-year period. We've probably quintupled our number of consultations, and the number of doctors working on our platform has remained largely stable. So why does efficiency actually matter? It matters mainly for 3 reasons. Number one, everybody's getting older. Number two, everybody's getting iller. And number 3, there's not more money around or resource around to treat more patients or more conditions. So how will Zava continue to capitalize on this opportunity? Number one, we'll dramatically expand our scope of treatable conditions. Today, we can treat around 60 to 70 conditions in this asynchronous, efficient manner. Over the next 2 years, we'll expand to around 400 to 500 conditions, and this is really the majority of conditions GPs can treat in a GP setting, face-to-face, or via call or via video. Number two, will increase the awareness of Zava and as a result also the telemedicine model in more general terms. Today, most of the population don't even know that they could get treated online, digitally. And during our research, we asked patients, so if you were to be treated online, would you actually choose to do so? The vast majority of patients would actually choose this model for the very simple reason, it's super convenient, and it's very instant. Number 3, digital healthcare is really going mainstream and will become free at the point of care for patients. So when I started the business in 2011, and since then, every single consultation which has been provided by us has been paid for by patients themselves. So if you grow up in Europe, in any market, in any country, primary care is free for patients in France, in Germany, in any market. And it's very unusual that patients actually pay for the level of care they seek in primary care. Now, over the last 12 months, regulators and statutory healthcare providers have opened up the ability for digital healthcare providers to come into the market and provide these services to patients. They've opened it up for 2 reasons, and these are the reasons why Zava is really well positioned to capitalize on this opportunity. 1, they want to provide more access to patients, and number 2, they need efficiency gains in order to treat more patients more profitably. We can see similar patterns in the UK, in France, and in Germany, and Zava is well positioned to capitalize on all 3 of these markets. As a result, when patients don't need to pay anymore at the point of care, but it's the insurance company, private or public, the sick fund in Germany, or the statutory healthcare provider in other markets, this will see a dramatic expansion of the market from, we believe, around 2.4 billion in Germany, UK, and France to around 50 billion in 2 to 3 years' time. The 4th way Zava will grow is to dramatically expand its geographic reach. So today, we're all based in London, but we treat patients in 6 European markets, Germany, France, the UK, but also Ireland, Austria, and Switzerland. And over the next 2 years, we'll expand into more European countries, predominantly Spain, the Nordics, Italy, and Benelux. In the 2nd phase, we'll also open up our services to Poland and Turkey before we move into the US. As you are aware, the US has a very peculiar healthcare system where care is very, very expensive, and most people are not insured. And it's really difficult for those people who are not insured to access care. Our convenient but very low-cost model will have the great opportunity to actually build its presence there. As a summary, we've used very little capital over the last 7 years to build a profitable 50 million run rate business. We've identified very significant opportunities both in the UK but also in Germany and in France to grow even further. An additional investment will enable us to capitalize on these opportunities very, very meaningfully. Number 1, we'll grab a big share of the emerging free-to-patient market both in Germany, in France, and in the UK, possibly also in Spain. Number 2, we seek to extend our lead in online self-pay. We believe most people are still don't aware that this exists, and as more people are becoming aware, the self-pay model will increase even further. And thirdly, we'll expand our geographic reach into Europe first, and then afterwards globally. So if this sounds interesting and ambitious, please come and have a chat. Thank you.
Wonderful. Thank you.